All right, so let's get started. Usually I'm right on time, so I want to get rolling tonight because what I got to talk about tonight is pretty darn important. So let's get to it. All right. Let's go right here, slideshow from the beginning. All right, first of all, welcome tonight. Sorry for a little bit of technical difficulty, but I'm 1000% sure that you are in the right place at the right time. Because what I'm going to share with you tonight is some really important information, updates of information that is in the injury space. So one of the things, you may not know me, my name is Dr. Kronk. I've done a lot of different things. I was in private practice for 17 years. I did over 1 million spinal adjustments. I've treated patients 175,000 times plus. I developed 2 spinal ligament testing companies, helped to develop the second one. I don't own that one. It was co-developed with a pioneering radiologist by the name of Stephen Brownstein. I have developed the systems that our radiologists use, and I also currently help to co-develop the system that I'm going to show you tonight. And what this system has done is it makes the possibility of something that I've said that the spinal injury market needs to have for a long time a reality, and that is standard spinal injury assessments. That's what tonight is about. So before I also start, I want to thank Dr. Brownstein for starting the company and for allowing me to merge into the company and put the horsepower into the company. All of our radiologists, our staff, Lori, Pam, Marla, Kim, Isabel, Tanya, Chrissy, Isaiah, and all of our radiologists. Because what we do is not, and what we have done is not easy to do. And that's what I want to show you today. So we help everyone in the market. We don't have any prejudice to anyone in the market. Anybody that's in the spinal injury market, we help them. There isn't anybody that we don't help. We're good for the chiropractic community. We're good for the physical therapy community. We're good for the pain management community. We're good for the surgical community. We're good for the insurance industry. We're good for employers. We're good for attorneys. We're good for defense attorneys, and we're good for plaintiff attorneys. And we're good for, most importantly, the people who sustain an injury. Because we help everybody in the injury. All right. So the biggest problem in the spinal injury market is a very obvious problem, but it's not obvious to a lot of people. And that is diagnosis. The biggest and brightest in the industry, basically, when you look at it, there is no standard diagnosis for a spinal injury. There's no standard workup. That's why some of the biggest and brightest say, hey, look, when we have low back injuries, 80 to 90% of the time, we don't have a precise diagnosis. 80 to 5% of low back disabilities do not have a pathoanatomic diagnosis. That means nobody knows the cause, right? If we look at the chronic pain market, it's the same way. Now, here's the thing. Everything that I've done, I'm a chiropractor. I have practiced for 17 years. I have a law degree, and I've been a business person for a long time now, integrating technology into the spinal injury market. That's what I have been doing. I have a very unique background. There isn't anybody that has a background like I have. There's nobody that's been doing the testing as much as I have. Nobody currently has as much experience as I have with this type of testing, right? So this testing has always solved this problem, but it's never been able to scale. And that's been its problem. So to kind of give you an idea, right now you can go out to any statistic. If a patient suffers a spinal soft tissue injury, the statistics are horrific. The chances of them having a full recovery are horrific. Now, in my experience, chiropractors give these patients the best opportunity, but chiropractic is small in the injury market. It's not really that large in the injury market. In the overall healthcare market, our profession, my profession that I'm part of, is 1/3 of 1% of the total healthcare market. So it's not it's not a large market, but it is very good at these conditions. The only thing it's not good at doing is standardizing the actual, and nobody's been good at standardizing the injury workups themselves. That's why these chronicity rates are so high. That's why low back is the leading cause of chronic pain and disability. Neck is the 4th leading cause. Chronic headaches is the 6th leading cause. That's why these things are so expensive. American Pain Society says if you have a low back injury from work, from an accident, from sports, from anything, and it causes chronic low back pain, this is what it's going to cost you per patient annually to medically manage. These are the chronic pain statistics. We all know them. These are patients come in an auto accident, have chronic headaches. This is what the American Headache Foundation Society says that they're going to spend annually in consuming medical services. Now, a lot of my fellow chiropractors will say, hey, we can do a lot better job with that. What I will say to my fellow chiropractors is we have to do a lot better job of standardizing the workups. A lot better job. All right. Sorry, I've got admins coming at me. All right. So let me get back to that current slide. All right. We also know, whether you know it or not, there's been an over-reliance on MRI. Now, MRI is not a problem, but early MRI and only MRI has been a problem. And the research shows it. Among workers with sprains, those who underwent early MRI were twice as likely in work disability in 1 year. Why is that? I knew why it was in 1995. Why is that? Because the main or a significant injury is not picked up on MRI. So if that's all you're going to rely on, then you're having a test do something that it's not designed to pick up. So I'm just going to play. This is just a couple little attorney clips of the confusion that's in the market. Now you can take advantage of this confusion. And I am not here to talk about how you build your practice or anything else tonight. I'm here to talk about expansive injury, expanding the injury space, and very, very state-of-the-art injury assessments now. So if I actually, let me play this.
My client's still complaining, but the MRI is clean, so it's like, well, shit, is my client lying or what's going on here?
Baffled me for the last 15 years as to why a scan would come back, especially an MRI, quote unquote normal, and somebody would have pain, then there would be no reason for the patient or the client, in the case that, to fake the injury, somebody like a professional, like a nurse that would be making good money and would want to go back to work and is now making far less. So that's what definitely learned in this conversation.
Good. So one of the things that's out there is there's a whole huge market that is baffled when a person does not have a positive MRI, right?
My client's still
Now that's also, let's say that the patient does not have a positive MRI, but somebody understands what I'm going to show you tonight. This is the results. At least the patient understands what the problem was. It didn't have to be 2 years later. Here it is.
I'm going to tell you, I've had a number of conversations. Lawyers here in Minnesota have come to appreciate.
Sorry, before I state that, I'm out of order. The one thing that the MRI doesn't do also is it does not pick up, in general, it does not pick up facet injuries. So it's not a great facet injury test.
The significance of facet joint injuries.
Yeah.
And Bogduck is the leader. I haven't
Bogduck
of all the facet joint research and evaluation. He says that 60% of the people that have chronic neck pain lasting more than 1 year have a facet joint injury. So I asked doctors and lawyers, okay, the facet joint is a place. it's not an injury. What is the injury in the facet joint?
We're going to show you that tonight.
Uh,
Now, we also have the case that I talked about where the person does not have a disc herniation. Unfortunately, this 15-year-old girl had to wait 2 years to get the proper diagnosis.
Doctor, let me explain what opened my eyes to the situation was after listening to you. I had Gina's case. Gina was a 15-year-old that was in a car accident. Her chiropractor did an MRI 2 to 3 months post-accident that showed up perfectly normal. 2 years later, Gina is still having significant cervical pain. And I used that as my first test case. We had x-rays done. In that particular case, they were done by motion x-rays, but digital motion x-rays. And your spinal kinetics did the assessment, a computerized assessment evaluation, and turned out that she had significant and rateable objective findings of significant motion segment integrity, both in her case, both angular and translational. And I decided to go back and have her have an MRI done a little more than 2 years later. And all of a sudden, this 15-year-old spine that had been imaged by MRI right after the accident as totally normal shows the degeneration of a 45 to 50-year-old lady.
I don't think that any daughter, any father of a daughter that's 15 years old should have to wait for 2 years for that daughter to get the accurate diagnosis. That's how I feel about that. Now, what I'm going to show you is the injury. I'm going to show you the actual injuries now tonight. So I'm going to play a clip. It's just about, I don't know, a minute, just under 2 minutes. And I'm going to let it play. And then I'm going to show you, I'm going to run some things back and forth and explain the significance of these things.
What we're looking at here is a severe angular injury to the spine itself. It's forced into an angular motion that exceeds the normal limits of that motion. The spinal support ligaments are damaged, and when the spinal support ligaments are damaged, the only place where they have to swell is into the nerve. So here you can see excessive angulation. The spinal support ligaments are significantly damaged, and they swell right into the nerve. This can occur whether there's a disc herniation or not, but if there is a disc herniation, it causes a complication. This is acceptive translation. Again, you'll see significant damage to the non-disc spinal support ligaments. This was picked up on X-ray analysis. And again, when these ligaments, these spinal support ligaments are damaged, they swell right into the nerve. We can have a severe spinal support ligament damage without disc herniation, but it's very rare to have disc herniation without severe damage to these spinal support ligaments, which is why they should be tested. When we go to the cranial cervical junction, there is no disc involved. So it's all spinal support ligament analysis. And this analysis is done on X-ray. We can see at normal translation on specialized stress X-rays in the upper cervical spine. These tissues, again, swell right into the nerve. In this case, the C2 nerve, and the spinal instability that results from this causes a myriad of symptoms.
Good. So let's go to it a little bit again. All right. This is in very slow motion. Obviously, that occurs in 1 to 2 100ths of a second. That is a facet injury. That's exactly what they look like. This is obviously an angular finding. Now, when we actually have the ligaments, the one thing that doesn't get understood or even talked about is the interforaminal ligaments. They're also there, and they're very susceptible to excessive motion damage. They don't have any place to swell, but right into the nerve itself. Now, and what are these for? What are these little fibers? What are these ligaments for? They're to actually keep the parts separate in the foramen. They're called the interforaminal ligaments. So this is why the capsular ligament and these ligaments are why every pain management specialist in the world is doing their procedures. This is what they treat. This is what every pain management specialist that you are working with treats. This is what you are treating. So if we look at this, go here, go, okay, that's translation. That's what it looks like. And then obviously there's a craniocervical junction, right? That right there. Boom. That's the problem. Now this stuff happens all very quickly. So the problem has always been, all right, let's go back to this. The problem has always been, this never scaled. It was always a problem. The medical breakthrough that we created, that myself and our team and an outside team created, is a medical breakthrough for this, because it allows for the first time for it to scale. Now, we did not build a chiropractic software. That's not what we built. We built a medical imaging software. So for the first time, it allows this thing to scale. It's FDA cleared. That's another big hurdle. Now, what it does is it takes the non-disco ligamentous injury, a term coined by Dr. Brownstein. It takes the non-disco ligamentous injury, which are the red ligaments, all these red ligaments, and it sets a standard for their assessment in their injury evaluation. So if you look, these blue are discs. Those are what we call disco ligamentous injuries, right? There's been too much attention on the disco ligamentous injury at the basic denial, practically, of the non-disco ligamentous injury, even though there are far more ligaments in the spine than there are discs. There's 220 special macro ligaments. There's hundreds, perhaps thousands of micro ligaments. But there's 220 macro ligaments, 23 of which are discs. Now, the AI-assisted technology that's been cleared allows this procedure to scale. This is something that no software out there. You got the DRMA and DXD and Posture, which I like, right? But none of these were built. Sumverta, what else do you have out there? You have these softwares, right? None of which were built to do what to scale throughout the United States imaging services sector. None of them were built to do that. That's what we built, right? And it is FDA cleared. So let me just explain to you once. This is an old way, right? So the old way is you actually had to take you had to develop, put in some sort of system, and somebody had to plot points. Plot. Okay, they had to do that. How many times do they have to do that? Well, they had to do 124 anatomical points for a cervical study and 87 for a lumbar study. If you did a full spine study, somebody had to locate 211 anatomical points. Now, that meant if you did 100 studies, you had to locate 21,000 anatomical points, right? If you did 1,000 studies, which 1,000 studies is not many, you had to locate 211,000 anatomical points. That was the problem. It never scaled, and it took a lot of time. Spinal kinetics, the only reason why spinal kinetics exists today is because myself, who's probably been driving it the most, wanted to standardize the spinal injury assessment market. That's the only reason why it exists. Other than that, it's a tough business. It's very, very labor intensive. It has been. So If you wanted to do 10,000 studies, I mean, you just put you put more zeros on here. Now, the new way, this is what AI does.
And it takes this long for the AI to plot the point.
Now, every single point is plotted on every single X-ray instantaneously. Now, that took a long time to teach it to do that. And with AI, as everyone understands, AI gets smarter as it gets older. It learns. So it gets more accurate as it goes. Now, I'm not even going to share with you the amount of studies that we had to put through this thing to train it. It was an ungodly amount. So this is very, very hard to create. It's not easy to create. It also was not easy necessarily to get it FDA cleared. Right? So we went through the whole process. Now, what it does.
This long for the AI to plot the points. Very, very fast. Now, this AI is because it picked up every single image in here very, very quickly and allows the radiologist to go in and change any points that they feel are not necessary. And you do that by actually really blowing up the images. You know, you can really blow this up. So you can see very, very clearly. I mean, if you're going to take an inside line, you can take the.
Now, for some of you, you've never seen this before, so you don't know how hard it is to do what we're showing you here, how hard it is to be that accurate, to be able to blow these things up and then be that accurate. And the thing is, it learns as it goes. So the beautiful thing is that one, it scales, two, it learns as it goes. So it gets better as it gets older. And it ages quite quickly. So it's not like a human where it takes a long time for it to age. It's just the only thing that requires aging is images. The more images you put in it, the faster it ages, the faster it gets mature. And it never stops. So
Outside line, and you can see
it allows for very pinpoint placement.
Miss these.
It allows for images to be blown up. It allows for a lot of different things. Now, what I'm going to show you next, sorry. Let's snap out of here. Let's go to this. All right. When you see, and you've seen this for a while, if you've used us, you've seen this for a long time, but I've never brought it up. This right here. This right here is the only indication that anyone can have that you have the correct size image. You don't have a magnified image. You have the real size of the actual image that was taken. Without this on a test, you do not know what the size of the image was that the person is measuring. So if I look at the softwares out there, right? There's softwares out there right now that the technology, and the reason why I know the technology is I've been through all the iterations of the technology. You know, I've been through when it was plain film, when you drew it with a pencil and a ruler. Then we went through where you had a CAD board and you used the CAD board as a specialized board with a specialized mouse. Then we went through, oh my gosh, Windows. What's a window? What was DOS? Now they have Windows, right? And then you had to have online because you had to have digital images and all the iterations I've been through. So when you're using a system out there, if you're a doctor who's using a system out there right now, and you're cutting and pasting or you're screen capturing an image and putting it into a system and then calibrating that image with some sort of calibration strip, you are using technology that is easily a decade old. Easily a decade old. I know, because a decade ago, it was state of the art. Today, it's not state of the art. And it's nowhere near as accurate as this is. So when you see this, this is a standard that should be on any excessive motion test, because it tells the person, if anybody else wants to measure it, This is what the actual size of the images are. Now, got to go back to the spine. Let's go back to the spine for just a second. Spine, and I'll do a Q&A after. You can ask me any questions on any topic. Spine only has two parts, so it's really easy to work up. It's just bone and connective tissue. That's it. There isn't anything else to a spine. If you had an arm that was just skin and bone and you injured your arm, all you got to work up is the skin injury or the bone injury or both. So if you didn't break it, you got connective tissue damage. There's only two connective tissue, discs and non-discs. Discs herniate. Non-discs cause instability and cause excessive motion. That's as simple as it gets. You do a consult, you do an exam, you take x-rays. On your x-rays, you're going to be looking for these non-disc ligament injuries. You're going to send them out for an unbiased, independent evaluation. I'm going to suggest that you use spinal kinetics. Now, most of you tonight are chiropractors. I'm going to tell you that our biggest reach right now, a chiropractor can do, maybe in a busy practice, they do 10 studies or 10 patients. Really busy practice, I don't know. There are groups that do a lot more than that. Okay, but let's just say a typical busy does about 10, right? In the imaging services that are, or the pain management services that are coming to us now with the FDA cleared model and everything else, they're doing like 600, 700, 800 injury cases a month, right? So they're looking at the same thing that you should be looking at. They want the evaluation because the evaluation supports what they're doing. And when I said a standard evaluation, there's not a chiropractor, a physical therapist, a medical doctor, or a medical specialist that shouldn't work up the injury the same because there's only two parts, bone and connective tissue. Didn't break it and you injured it, it's a connective tissue injury. That allows for standardization of spinal injuries. That allows for treatment innovators to really treatment innovate. That allows for much better statistics in the injury market. That allows for providers to be completely guideline driven. So an MRI report is to the blue ligament what an excessive motion test is to the red ligaments. The test immediately tells me how bad and where is the worst part. What grade of sprain do I have? Do I have grade 2, grade 1, grade 3? Tells me right away. It also tells me right away, it allows me to put myself, this is chiropractic treatment guidelines. These are Croft treatment guidelines. I could go to surgical guidelines, which I will. I could go to facet injection guidelines. Different providers have different guidelines. The majority of doctors tonight are chiropractors. Let's just go to chiropractic guidelines. If you have care that supports a particular level in your guideline, it's harder to cut the care off. Now, the reason why care gets cut off so easily is there is not support because the main injury is not even picked up. It allows you to determine, do you have a permanent injury right away? And you don't need to have alteration, motion segment integrity to have a permanent injury. Is it a surgical case? Well, the alteration, motion segment integrity numbers are in surgical guidelines for spinal fusion surgery, which means for me as a chiropractor, when I saw it in 1995, I used it forever. Because it was like, wow, look at the significance of this. I called it a subluxation at the time. This subluxation that the medical groups have now said is a 25% whole person impairment that the surgical people have said causes spinal fusion surgery, can necessitate. Doesn't mean that you're going to do spinal fusion surgeries. Your job is to keep them from ever having a spinal fusion surgery through your conservative care stabilization procedures. So I used that to the hilt because I got very good at stabilizing these injuries. And I used this to show how significant the injuries are because myself and my profession were not taken very seriously. In case you haven't noticed, that's been a long-term thing. I went to college and was in college when the Wilt case settled. I was at the college when Jerome McAndrews at Palmer College was the president of the college, and his brother George was the lead attorney that did the Wilkes case that got the anti-discrimination lawsuit, monopoly lawsuit that chiropractic won. So been around this for a while, right? By the way, you're very good. We're very good at stabilizing these things. It also shows exactly where the facet injury is. Shows exactly where it is, right? Shows if you should actually reduce a person's activity, such as contact sports. It shows if you have a higher probability for disc herniation when you go to do the disc study. It says all of that. And it takes literally 10 seconds to read the report and know what I just said. Now, that's a pretty high level, but it's a very easy ladder to climb. Like super easy. Like insanely easy. Now, independent medically performed studies improve chiropractic's credibility and generally result in faster, fairer settlement processes. All right? That there isn't a lot. There's nobody in the market that would contest. I do a lot of training of attorneys. I'm on the phone and I'm involved with attorneys a lot. If I ask them a standard question, if it doesn't matter if it's a medical doctor or a chiropractor, or it doesn't matter. I mean, the spine surgeon that actually does his own MRI reads and doesn't have the radiologist read, and only his reads are what supports the spinal fusion surgery or the spinal discectomy. Everybody in the market looks at them like, I don't think so. Something's wrong. That doesn't seem right. Could be some bias there. It's no different when chiropractors try to do these studies themselves, and especially if you're using technology that's 10 or 15 years old. It doesn't fare well. It doesn't look good. It's not good individually, and it's not good as a group. So if I ask attorneys, would you want an unbiased independent study? What do you think they're going to say? That there isn't a lot of value to having these things done independent by an unbiased party that doesn't care how damaged they are. Right. Would you agree with that?
Absolutely.
I'm gonna hit this off kind of at the pass. If you're sitting there with a lawyer, would the lawyer prefer to? This is a major legal expert that goes in and triages cases for law firms, large cases. Have any testing be done by an unbiased, independent, third-party medical provider?
Yeah, always.
Always. So there is no question. I've said that for years. I could have done testing in my own clinic. The reason why we did the testing externally is because the results are so significant. 20, 29, 30% of the patients are going to have alteration of motion segment integrity finding. Right? You have softwares out there that are producing a lot higher than that.
Should also show it should be very specific of what tissue is injured and the magnitude of that injury. We take our flexion extension x-rays, we have them sent out to Spinal Kinetics. They do their very, very detailed analysis, looking at down to the millimeter. What we get back is a report. There's some images in there, but the importance of the report is quantifiable data of injury.
Good. So that there isn't a lot of value to having these.
I wish that.
Now, I'm gonna actually say this as well, is that I want you to listen to one of the top injury experts in the country, insurance claim processes experts in the country. He's not an attorney. He's not a doctor. He worked as an executive for State Farm and Allstate. And this is what he says.
That attorneys would jump on board and recognize the experts that you are, but there is always going to be that perception or attitude from the legal community that they'd rather have an orthopedic or a neurological surgeon on board, which ultimately maybe that's the case, but without the chiropractor, the rehab physician, providing the early diagnosis, the early documentation of symptoms or complaints to support what goes on 6 months, a year, 2 years down the road, the claim can be defeated without your expertise. So
It's just that easy. It's just that easy, but you have to assert that expertise. So I'm just going to play a last clip here, and I could play 100 clips. I could play 200 clips. I have so many clips of different things and different things that I've seen or have, recorded. So I just picked some that I thought were somewhat relevant. This is the presentation that you just saw. I presented, I don't know, maybe 6 weeks ago, 5 weeks ago, 7 weeks ago now, whatever it was, for 20 minutes, 30 minutes. We ended up spending 45 minutes to one of the largest law firms in Seattle. They have a big group meeting at the ballpark, at the professional ballpark this year in June. They already had a setup with speakers, and this is what he said. Listen to what he said.
Well, I mean, Doc, you're impressive. I mean, we talk to a lot of folks that I think you're, top flight as far as the way you describe this. So break it down for people to understand. I would like our in an ideal world for our audience to be able to hear this. Let me check our schedule one more time and see if we can fit an hour. You're so great at this, it deserves an hour. Most of our speakers were saying, I know you want to talk for an hour, but let's turn it to 30. I think yours is the other way around.
Okay, so
Well,
here's our process. Our process at Spinal Kinetics is very easy. And you want to if you're not involved with Spinal Kinetics right now, trust me, you want to establish an account and you want to send in studies to us. I'm not going to tell you why, but I am going to tell you that at some point you would be grandfathered in so that you would be able to use us always. That may not always be the case. So you want to be involved. It's very hard to produce this to the chiropractic community. It has been, because the chiropractic community is kind of fickle. Sometimes they use it, sometimes they don't. If an attorney says something bad about it, they don't know what to do with it, and they don't know what to how to support it. We're here to help you, and I have lots of services and lots of things that I do to help. But you want to get involved with us, and you want to start testing. Testing and knowing what you're doing with testing will change your career, just like it did mine. The process is super simple. It's all online. Fill out 3 easy forms. You upload the images and the paperwork into our system, and you get your reports back in 24 hours or less with a HIPAA compliant portal that's right on your computer. It's simple. Nothing hard about it. Now, at this point, what I'm going to do is, I've said a lot I could say about how this helps you to build your practice, or how it helps you to get a lot more people into your practice. I could say I could tell you how it helps to grow your your chronic pain practice. I could show you how you could have the largest headache center in the world if you wanted to with this understanding. But here's what I'm going to tell you. We have a podcast. I highly recommend you start listening to it. It's called Smart Injury Doctors. You look it up on Google Play, look it up on Apple, look it up in Spotify, look it up. It's very easy to find. Just Google search Smart Injury Doctors, and then basically sign up, enroll, get it so that when we put out a new one, you get a message. Listen to this stuff in your car when you're driving to work. Listen to it when you're going home. Listen to it, because they're short, 9 to 16 minutes. And I give you information in bite-sized pieces like what you just got tonight. What I just gave you tonight is not easy to swallow. Like, what? Oh my gosh, huh? Like, all I can tell you, doctors, is when I saw this, the very next day, when I saw excessive motion testing, the very next day, I was testing. The very next day, we were sending out for testing. As soon as I saw it, because I knew it was the way to, one, be able to determine how badly damaged the patient was. And I knew there was more than an MRI. So We also have a free group. You can get information on called the Smart Injury Doctors Practice Building Success Network, which took out secrets and changed it to network. It just didn't change the slide. So you can look us up. We want you to have as much information about this and about this type of testing and about what you're doing with it. Now, I'm going to open it up to Q&A. I'm also going to tell you that if you want to set up an account, I highly recommend you do. Here's how we set up accounts at Spinal Kinetics. We set up an account with you when you have an image to send in, when you have a study to send in. Now, the reason why we do that is because we don't want to waste your time. If we train you how to send in, but then you wait weeks to send in, you have to waste your time being retrained. Now, again, when we have clinics that are sending us 80, 90, 100 studies a month, they're sending us in the studies and they don't have to be retrained. They're sending so many of them. I mean, it's like clockwork, right? But if you don't have a lot of cases and you start to use us, you're going to be asked, we're not going to set you up until you actually have a case, but call us, let us know. Hey, I'm interested in this. I want to get involved with this. I don't have a patient yet, but this is when I think I'll have a patient. Can we get this thing set up? The majority of you have patients to go right now. If you have any patient volume at all, you have injury patients in your clinic. And they don't have, without this type of a test, they do not have an accurate injury analysis, period. You can take me down for saying it. I'll say it. I'll say it to you. I'll say it to hospital administrators. I'll say it to imaging centers. I'll say it to attorneys. I say it to insurers. Injury consultant, doesn't matter. Without an excessive motion test, an accurate excessive motion test, you do not have the full injury status of that patient. Okay, I'm also going to say this. You want to be on. When I give future talks about this or how it relates to pre-existing conditions or how it relates to documentation, you want to look for those with Spinal Kinetics and be on those. So what I want to do now is go to Q&A. So I'm going to stop sharing for just a second.